Alrighty, good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Systems Building webinar for January 10th, 2024, to our first webinar of the year. As a quick reminder, our webinars for 2024 will continue to be held on the second Wednesday of the month at noon. Everybody who had previously had this webinar series on their calendars should have received some Zoom correspondence with instructions on how to add this new series to your work calendars. That would have come directly from Zoom with the subject line KS Early Childhood Systems Building Webinar 2024 Confirmation. I know I got a few emails after sending out the reminder email yesterday and helped a few folks get this onto their calendars. So if you have yet to do so, you can email me at jgruss@ku.edu and I will go ahead and resend you that confirmation so you can get these on your 2024 calendars. As always, please remember to sign up for our weekly All In for Kansas Kids e-newsletter. You can do so on the Children's Cabinet website at www.kschildrenscabinet.org. Today, we have some wonderful presentations that we will start off with, and then I will just give you a few early childhood systems updates. But I think we should be taking up the largest portion of the meeting today. I know last month we ran a little short, but we've got a robust group here today and a lot of information to give. So we have presentations from Loretta Severin and Mariah Winter on Iris, and they will also be doing a live demo on how to use the Iris website. And then we have Michelle Reichert with KCSL, who is going to give us an update on our 1-800-CHILDREN number. So we're going to get started right now with Loretta kicking us off with our presentation on Iris and growing connected networks for Kansas families. Go right ahead, Loretta. Thank you so much.
Okay, thanks, Julia. And I'll just say next when I need my slides advanced. So thanks for running that today. Good afternoon, everyone. Thanks for joining us on what may be a snowy day in almost all parts of Kansas, I assume. My name's Loretta Severin, and as Julia mentioned, I'm with the Center for Public Partnerships and Research at the University of Kansas. I'm joined today by my colleague, Mariah Winter, and we're going to visit with you about this concept of growing connected networks for Kansas families. Really, the intent of our conversation today is to share a bit about Iris, the tool, and the approach, and how it is designed to help communities improve the ways that families are connected to the services and help they want and that they need. So specifically, we'll talk about Iris and the benefits that communities find when they intentionally build a network of providers in the community that hold families at the center. And we'll also touch on opportunities and next steps that each of you can take after today's webinar, regardless of where in Kansas you live and work. Next slide. Thanks. As I mentioned, and as I'm sure many of you are familiar with, we are affiliated with the Center for Public Partnerships and Research at KU, where our mission is to optimize the well-being of children, youth, and families. And Iris fits right in with that mission in terms of really optimizing the way that families access resources in the community. Next slide. All right, so we're just going to begin today's presentation with an acknowledgement and a question. So first, let's just come together with the shared acknowledgement that everyone, all of us, all individuals, all families experience times in their lives when they need the help and the support of others. And when a family has that moment, when they recognize they have an unmet need or they desire support or resources and recognize they could benefit from the help of others, we have a question about how families find what's available to them in their community and how they access it. So you might be thinking or reflecting for yourself, what that looks like for the families you work with or your own experiences you've had in that space in your community. And we know it can look a lot of different ways. It may be the case that the family shares a concern with their trusted family and friends who may know of something or someone who can help them and point them in the correct direction. Or they might use the resources available to us here in Kansas, like the 1-800-CHILDREN call line or 1-800-CHILDRENKS.org, that enables families to search for and find help in locating resources and supports that are available in their community. Or another way families find help is they might share their concern with a trusted professional. For example, they might mention to their childcare provider a concern they have about their toddler's motor skill development. Or during a prenatal visit, they may mention food insecurity or that concern to the nurse or practitioner who is helping them. And in those instances, when a provider hears a concern, they can really serve as a critical bridge from that moment of concern, that moment of identifying a need for help, to the community resources that are designed to meet that family's specific need. Next slide. So I mentioned that as a bridge, right? That provider as being the first point of contact who can bridge a family to the other places in the community that can help. But another way to think about that is to think of providers or those who have contact with families in their professional role as doors. Doors families can open and walk through to access all the information about how their community can help them. We call these right doors and have a vision in Kansas of creating as many right doors as we can in a community so that no matter which of those doors a family walks through, they can be connected to everything that's available to help and support them in the community. But providers can't just do this. They can't just wake up one morning and be a right door. There are some conditions that must be in place and some skills providers must have. So, for example, providers have to be confident receiving concerns and discussing and assessing what the family's needs are. Really asking the right questions to build a better understanding of exactly the kind of help that family might be interested in receiving. To be a right door, providers also have to know what's available in their community. And that can be a really daunting task. What are all of the many resources and services and programs that exist here in our community? And how do I know the right way to get families connected to those services? Too often in communities, each organization or program has their own way that they prefer to receive a referral or a connection from a family. And that can make it really difficult to navigate how to make those connections in the best possible way. We also think that right doors happen when the person who makes a referral knows whether or not the family ultimately received the help they were envisioning. That builds trust and accountability in a community, and also trust and accountability between that family and the provider. And then the final piece of many that we think it takes to be a right door is relationships and communication between providers in the community. And we'll talk more about that here in just a second. So go ahead, Julia. So we think it's possible to build those right doors and position providers as right doors with a combination of two things. One, technology, and the other being collaboration and relationships between the providers and the community. And that the kind of unique marriage between those two items that we've built in Iris is what can facilitate the creation of right doors for families. Go ahead. So Iris is the technical tool that we've built to meet the first half of that need. Iris is a closed loop referral platform. It's an online system that providers can access on their laptop or on their mobile device. And it's designed, oh, you go back a second, Julia. Thanks. And it's designed to just make it so easy for providers to know the resources that are available in their community, even resources they've never heard of before or resources they didn't know existed. Understand those resources, really have a good sense of exactly what the programming is they provide and how to know if a family is eligible for those services. And then once they've been able to identify those services and really build that understanding, Iris is designed to make it really streamlined to make that referral so that when the referral is received, what the family experiences is a quick phone call or a text from someone who understands their need, has some key details about their situation and the help they're seeking, and can make an immediate connection with them to offer them that resource. Okay, next slide. So I mentioned, I think at the beginning, that we really like to think of these right doors all functioning together to make a network. And what you're looking at here is a picture, a visualization of what one of those networks looks like. It might not make much sense when you're looking at it with fresh eyes, but here in Kansas, this is the representation of all of those programs and providers, those gray bubbles, who are serving as a right door in their community by using IRIS. And then those purple lines are the connection points. So which providers are connected to which, how many referrals are they making, what's the frequency of their contact. And so this is really what a network can look like when we draw a picture of it. And we know that the technology is behind the scenes driving some of the growth of those circles and some of those purple arrows, but it's not the whole story. Next slide. What we know it also requires is that it's not just that technical connection between the programs and providers, but those programs and providers are also operating under a shared vision, shared practice, and a shared sense of accountability and collaboration. And the next slide will show a little bit more about what we mean when we say that. Those programs and providers who function within their IRIS network don't just log into the same system every day to make referrals, but they also come together as a group of like-minded collaboratives to address issues and talk about the way they use IRIS to meet the needs of families in the community. And so what you're looking at here is a visual representation of the process of a community building an IRIS network, the steps that local stakeholders and leaders and program representatives go through together in the same room physically or in the same Zoom room remotely as they think about what their vision is for IRIS, how they hope to transform connections for families in their community, and then go step by step through each of these processes so that at the point in time when they start using the technology together, they really know what to expect from one another. They've defined what accountability means when it comes to this concept of referrals in the community, and they have a shared sense of practice. I know when I log into IRIS how I'll use it, and I know that when you log into IRIS, you're going to use it in the same way so that every time we make a referral for a family, it's consistent and streamlined, and everyone gets the information that they need. So that's that second piece of the puzzle. We have the technology and also the collaboration that's happening among providers in the community as well. Next slide. So this is a map here of the places in Kansas where IRIS is currently utilized. And I'll pause here and give you a second to think about it, because at the end of the presentation, we're going to talk about possible opportunities and next steps for each of you. And those opportunities and next steps will be driven by where you are geographically on this map. But each of these counties shaded in green is a county where IRIS is utilized by providers. So there's an open opportunity to continue building networks in those green counties, or excuse me, to expand and grow the networks in each of those green counties, but also to look at the counties that don't yet have access to IRIS and think about where leadership might exist or what it might look like to build networks there. Something I'll just point out, it's a little nuanced, but it's probably a question in your mind is, in these instances where counties are neighbors together, are they each their own network? Are they talking to one another? And by and large, yes. When networks are close neighbors sharing boundaries, they often function as one IRIS network, because we know that families, especially in rural areas of our state, may reside in a different county or community than the county or community where they access services. And so those networks are built to enable referral communication across those geographic boundaries. Okay, next slide. Okay, in just a second, we're going to give you a peek of IRIS, but first I wanted to share a little bit about the impact of IRIS in Kansas. You saw the coverage across the state on that prior slide, but here you can see that we are close to having served 18,000 Kansans through IRIS referrals, with about 29,000 referrals. And something we really like to see from a data perspective is that discrepancy between the number of families referred and the number of referrals, because that means families are being referred more than once to more than one service, which is a great indication of how those right doors are functioning in the community. And then I'll also just note that we're able to track through IRIS, what the ultimate outcome of those referrals was. And here in Kansas, about 42% of referrals that are made result in the family or individual enrolling in the service or receiving the help that they had in mind when they agreed to that referral. Next slide. Okay, so now I'm going to pass it over to Mariah, and she is going to show you what a provider's experience is of having that moment when they're talking to a family and understand this may be an opportunity for a family to be connected elsewhere in the community to a service, and what it looks like in practice for them to log into the tool and make that referral happen. So Mariah, it's all yours.
Thanks, Loretta. Get my screen shared here. All right, can I get a thumbs up if you can hear me and see my screen? Perfect, thanks, Loretta. So as Loretta said, today I'll be demonstrating how to send and track a referral using IRIS, kind of acting as an IRIS user at a child care center. So kind of have a scenario to play out here that I have been in communication with one of the families that I serve, and they have expressed to me that they have a concern on their child's language development. And so I'm just going to step through the process of what it can look like to get that family connected to services to address that need. So to begin with, we're going to click a new referral button here and be brought to our family profile screen. So this is where I can search for a family profile that I'm sending a referral on behalf of, or create a family profile if they do not have one. I'm always going to be asked to verify that I've been given proper consent anytime I create a family profile or initiate a new referral. And then next, I'm going to land on the partner selection screen. And so this is where I'm going to use some of the features of IRIS to help me identify the right partner, the right door to help meet this client's need. And so first, I'm going to look up here at the top at our service area filters. And I'd like to note that these service areas are configured by the community to kind of reflect that local network's referral landscape. So it will vary from network to network. But I'm going to use these to help me just filter down through this kind of long list of providers to help me pick the right program. So I know that this child is young, so we'll maybe start with an early childhood filter to narrow down here to just 6 programs, but also with the language concern, going to look at maybe see if anyone provides developmental screenings. And that brings me to early intervention. I can also click see details here to get just a little bit more information. It's going to pull up that provider profile. So I can see some information about EI here, including their location, some contact information, a little bit about the program, the eligibility criteria, but we'll also see this capacity bar, which allows providers to communicate to others like myself what their capacity to accept referrals and ultimately serve families are. So we see that they're in the green. They look like a great fit. So we'll go ahead and click on that card, highlighting it in purple, indicating that I've selected it. And then we'll click next. And now I'm going to be brought to the referral details page where I can enter some of that key information about the family and their need that Loretta was mentioning. So the referral fields on this page, this is another feature of IRIS that is configured by the community, but as you can see, it's a really simple and streamlined referral form intended to communicate, again, that key information to partners to help them determine whether or not they're going to connect with a family to see if they can help them. So just quickly fill this out. And click submit. And that's sending that information directly over to the sending or the receiving agency, in this case, early intervention. And that agency has just received an email in real time letting them know that a referral has been sent to them in IRIS, so that they can get in and see if they're able to help the families. You might also want to go back in later and see like what has happened and follow up on those referrals. And so if you'd ever like to, if I want to check the status of those referrals, I can go back to my home screen in this kind of referral dashboard. And in my outgoing referrals tab here, I can see the status of the referral that I just sent on behalf of Jamie Smith, which is in sent status, and that's indicated here with just a seed in a pot. But I can also see another referral that I sent previously on behalf of Jane Doe that has been accepted, represented here by a sprout. I can click on this referral if I want to and see any comments that were made or notes that were made by that receiving agency that lets me know that they'll be in touch with Jane Doe's family. And I can also check in my recently completed tab to see the outcomes of the referrals that I've recently sent and have been completed in the last 30 days. So I can see here that Marge, who I referred to the food bank, has been enrolled in services or her needs have been met. And again, I could click on that referral card also to see ultimately kind of the steps and the communications that were taken by that receiving agency here that shows that the family will be receiving a food box this week. So that's just a really quick rundown of how to make and kind of track a referral in IRIS.
Thank you, Mariah. Okay, so just a little additional information with our last few minutes here. Julia, you can go ahead and advance. Yes, so we're going to talk now about what you could do next as a result of the information shared today. Go ahead, Julia. So first, if you think back to that green map, if your community has an IRIS network, if you live in one of those communities that was highlighted green, here are some ideas of things you might do as next steps. First of all, maybe you already are a program using IRIS, in which case, hooray, let's celebrate that. But if you're not, the next step I would recommend is for you to connect with your local IRIS leadership team. Your local IRIS leadership team will be comprised of probably 2 to 5 stakeholders from one or more organizations who hold the day-to-day responsibilities of managing and maintaining your IRIS network. So these are the folks who can onboard new partners to the network. They're the ones who bring partners together on a quarterly basis to review their impact data and make decisions about next steps with the network or to troubleshoot issues that come up. And they'll be a great resource for introducing you to your IRIS community if you're interested. Your first request to them might be just to tell you some more about how IRIS is used in your community. And then you might also ask if you can participate in an upcoming meeting. Regardless of if IRIS is a fit for you and your program needs, those meetings can be a great place to meet additional organizations, build relationships, and learn more about kind of the landscape of referral possibilities in your community. I would also encourage you to consider if IRIS is right for your program. So if in your day-to-day work, you or the staff you work with receive referrals for families or make direct referrals for families on their behalf, maybe you currently do that through a quick phone call or email, you should consider if you would benefit from transferring that process into an electronic system by IRIS, or excuse me, like IRIS, and consider some of the benefits that might bring to your to streamline your workflows. Also, we know that it's not always the right time to make a big change. IRIS is a simple tool and it's easy to learn how to use it, but we also know that best practices for programs to really think through their workflows and expectations for their staff and to devote time to developing processes like client consent processes that are essential to making quality referrals. And so if now isn't the right time, you could still get connected with that leadership team and consider in the future when you may have the capacity and interest in making those changes. So if you are interested in learning more, my contact information will be at the end of the slide, and that's how we can get you facilitate an introduction for you to your local IRIS leadership team. Okay, and go ahead. Thank you, Julia. So if you're not in a green community, if you're in one of those gray communities, a couple of things that we think you could still reflect on today to consider improving how families are connected to services in your community. Simple question is to just reflect on how families currently experience referrals. What does it mean for a family to access help in your community? What are the mechanisms that support that? Are there things that could be improved? Are there places that you suspect families might fall through the cracks? That's a reflection you can do for your own program or based on your own experiences. And then you can talk to other programs and providers. How are they making those connections? What's working well for processes and what are the limitations? Maybe a system such as IRIS might help to support better communication and increased referral coordination in your community. But maybe you could just get together for a simple meeting and do some collaboration outside of the tool to understand the issues that are happening and develop solutions at the community level. And then you could also consider sharing IRIS with others. So if you leave today and you think about these questions and you feel really sparked about the idea of IRIS, there are resources on our IRIS website, and we'll get you that URL in just a second, that you could share with others in your community to help them understand what IRIS is and to help spark a conversation about maybe the applicability of implementing IRIS locally. And the other thing, it's not a bullet on this slide, but another thing you might consider is if you live in one of those boundary communities, if your county was gray, but you're right next to a big bank of green counties, I would still encourage you to get in contact with that local leadership team. IRIS networks grow and expand all the time, and there may be opportunities to naturally expand that network as well. Okay, next slide. Great. So connectwithiris.org is our website. There's a short video there that gives a 5-minute overview of IRIS that might be helpful if you want to share this with others in your own program or in your community. We also have information there about what it looks like to get an IRIS network up and running. And there are a number of stories directly from communities who use the tool. Some of those stories are from outside of Kansas, but there are also stories from the Kansas City area and Northwest Kansas and Sedgwick County that really highlight how IRIS is being used there and the impacts those communities are seeing as a result. So it's a great place to get a lot of information. And then also, you can email me and I can put you in touch with all the right folks, either in the local community or I can answer questions you might have. Specifically, if you're thinking about wanting to know more information about what it would look like to build an IRIS network in your community, I would be a great starting point for that as well. So Julia, I noticed there were some questions in the chat. Would you prefer I just go ahead and answer those in the chat versus doing that during the live presentation?
Sure, absolutely. You can read
Okay.
the questions aloud and then answer as applicable.
Okay, great. Let's see. All right. Let me get my screen a little bigger here. Okay, so we'll start with Aaron. Hi, Aaron. Aaron's asking about the communities that are currently using IRIS. What is the range of number of organizations in each community? Right, so curious about the range of number of service providers enrolled in IRIS that are finding benefit. Great question. And kind of an answer to a question you're not quite asking is, in No IRIS network is every single agency and program and service participating. IRIS is driven by local vision, and so a network might begin because a group of early childhood program providers think we have got to find a way to help families get access to the food supports in our community and to the transition into elementary school. We're going to build a network just designed to do that. So it could be a pretty limited network. The other thing I'll note is that IRIS is a tool that hinges on engagement. So partners and programs that are listed as participating in IRIS have gone through the implementation approach and they are participating and saying, yes, we will engage with the referrals we receive through the system. But to answer your question, Aaron, in the greater Kansas City metro, where there's a network that supports Jackson County, Missouri, Wyandotte and Johnson counties, and some of those neighboring communities, there's about 165 organizations that utilize IRIS there. In a smaller network, let's see, maybe the Wildcat region around Riley County, Clay, and Potawatomi and Gary, that might be closer to a 40 organization network. So a lot of variation and also a lot of agency at the local level to define what those numbers look like. And I think that will answer the question from Little Orchard Montessori about organizations using IRIS in Johnson County. Yes, there are. The number I wouldn't know off of the top of my head, but there is a good, especially like early childhood, maternal child health presence in Johnson County. And I can certainly put you in contact with the local leader there if you would like more information. And great. Question about cost. Yes. So in those green communities, there is no cost for organizations to join IRIS. Typically, while there is a cost to maintain an IRIS community, what we have experienced is that those local leadership teams or key stakeholders in the community say, we've got this. We see the benefit of this for our community. We'll cover the cost year to year to make IRIS available for any organization who chooses to use it. So it could be the local health department that's paying for the cost, or another private entity that's written it into an annual grant so that they can cover those costs. And what that does then is enables those networks to grow and not have any concern about if their cost will grow over time because they've added additional partners or because they're making a lot of referrals in the network. So yes, in Kansas, you wouldn't experience any kind of cost requirement in order to join a network. Okay, it looks like those are the questions. And Julia, I know there's a next topic you want to get to, so I will go ahead and close out here, but Mariah and I are here and can keep answering questions in the chat as they come up.
Alrighty, thank you so much to Loretta and Mariah for that wonderful presentation. Super relevant to everybody here watching, and IRIS is just a very intuitive, easy to use, and aesthetically pleasing website. So thank you so much for that information. Let me go ahead and get my screen shared again. I was having a little bit of a problem with that for some reason. Erica, so sorry. For some reason, it is not allowing me to share my screen. I'm getting an error message. Are you able to pull up the presentation and get that shared from your end?
Yep, just give me a minute.
Thank you so much. While Erica is doing that, I will introduce our next presenter. Her name is Michelle Reichert, and she works with the Kansas Children's Service League. And she is going to be giving us an update on the 1-800 Children's number, how many people have used it, kind of who it's helping, and just an overview of that. So just give Erica a second here to pull up the slides, and we will get that presentation back up on the screen, and then Michelle can get started.
Hi everyone, I'll go ahead and introduce myself. So thank you, Julia, and everyone for having me today. Again, my name is Michelle Reichert. I'm the supervisor for the 1-800 Children program through Kansas Children's Service League. And they're not paying me to say this, but I just want to say that we work with Mariah and Loretta regularly, and we're working on getting 1-800 Children connected with IRIS, and they are a joy to work with. So very happy to be here with them today. All right, thank you. Okay, so I think many of you are quite familiar with 1-800 Children, which is great. So I'm not going to go into the full spiel, but I can certainly do that for any agencies and groups that want to go more in depth on 1-800 Children. But I'm very happy to provide an overview and an update on 2023 numbers for you today. Next slide, please. All right, so there are 4 ways to access the 1-800 Children program. So we have our 24/7 call line at 1-800 Children. We also have another phone number that originated as the parent helpline back in the early 90s. And both the parent helpline number and 1-800 Children, they funnel into the same place. There are 5 of us that answer those phone calls, myself and one family support worker in Topeka. And then we have 3 family support workers in Wichita. One of those family support workers is bilingual in Spanish. So during the business hours, she takes all of our Spanish calls, which is really helpful. We can also be reached by email or text message at 1-800-CHILDREN@kcsl.org. We do only answer that during business hours, but everyone that reaches out to us gets an automatic response that has information on how to call us if they want to connect with us immediately. It has the DCF Protection Report Center line and some other resources, so that way, even though we may not answer them right away, they're still getting information from us right away, and they can connect with us however they want to. And then we have our 1-800-CHILDREN-KS.org resource database that contains thousands of resources of all types across Kansas and even some nationwide ones. And then our mobile app, our 1-800-CHILDREN-KS mobile app, that is a mobile version of the resource database that is available at no cost in all of the Apple and Android app stores. So next slide, please. All right, so these are just some characteristics of the 1-800-CHILDREN program. So we are statewide. You know, we accept calls and things from anyone. We actually get quite a few out-of-state calls as well. For states that don't have a 1-800-CHILDREN line, their calls roll to us. That's a partnership that we have with Prevent Child Abuse America. So we do get quite a few calls also from around the country, which is really interesting. We are available through the call line and the resource directory 24/7. Most of our calls come in during the day, but we do get calls in the middle of the night sometimes. Sometimes, you know, there's a parent who is really struggling, their child won't go to sleep, or they're concerned about something, and they just want to talk to someone, you know? So we never know what's going to happen when we answer the phone. We're available in the multiple media, like I shared a minute ago. We are a no-cost resource, so of course we receive funding that we're very grateful for, but there is no cost for people who call us or people who access our online resources. We are accessible in over 200 languages, so we use a language line service for phone calls, so we can have a translator for really any language you can think of. And then our resource database is translatable the whole website through Google, which is awesome. So we can meet the needs of anyone, no matter what language they speak. We are an anonymous resource, so, you know, people do often disclose their name. We always ask for zip code. That way we can kind of narrow down resources for their local community. But a lot of people, they don't want to disclose their name or their phone number, which is totally fine with us. You know, sometimes the situation is really sensitive, or maybe they fear connection with any sort of state agency. You know, you just never know the reason, but we do respect anonymity when people want to maintain that. We're also available without any sort of eligibility or income requirements. So again, we are literally available to anyone. Parents, caregivers, professionals. Our target audience is parents and caregivers of children ages 0 to 18. But we do get calls from all kinds of people, you know, adults that don't have children, but they still need help with housing or food, things like that. I had a call a couple months ago from a woman who was concerned about her elderly brother and his health concerns. So again, we just never know what's going to happen when we pick up that phone. Next slide, please. So this is data from calendar year 2023 for the call line. So in 2023, we had 1,078 phone calls. And of those, 98% of the callers reported that we, you know, helped them with whatever they were looking for. Maybe we didn't help solve the problem, but, you know, we helped them along with next steps in the process, whether that's connecting them with a referral or providing them information, things like that. So of those callers, 78% of them were either a family member, a caregiver, or someone related to the child who they were calling about. 11% were professionals, whether that's school personnel, counselors, things like that. And then 11% we were not sure of the relationship. So the reasons people call, this is, I think, really helpful information. These are the main reasons people call us. So a lot of program information, how can I get a hold of this program, or what programs in my area help with this, that kind of thing. A lot of mental health concerns, and that might be connecting them with counseling services in their area, crisis lines, things like that. We get a lot of custody and guardianship questions, legal questions, a lot of connections to kinship services for people who are raising children and they need that legal support. A lot of questions on supervised visitation for parents going through custody situations, things like that. And then I would say the rest of our calls really have to do with parenting. So maybe concerns about their child's behaviors, needing parenting classes, and then concrete supports. We get a lot of calls about needing assistance with housing, with food, with clothing, transportation, all the things that I think a lot of us know are really important and sometimes scarce for the people in our communities. And then most people call us during the morning, which is kind of nice. But again, we do get calls all day long. All right, next slide. I just want to let everyone know that we started doing the Ages and Stages questionnaire, I believe in 2022. So I know that a lot of programs offer the ASQs, the different screenings for child development. And we are now one of those programs. So if you know someone who's concerned about their child's development, they are welcome to call us and we can help them with that at no cost. And then get them connected to local child development centers if necessary. Next slide. All right, so these are just a few bright spots with the call line. So the first one is we had a woman who had lost her job. She had no transportation. She was concerned about providing food for her family. So the phone counselor was able to connect her with a resource that would deliver food to her home. Another one is we had a mom who called us around 9 p.m. She actually was laying in bed with her daughter who had just fallen asleep after crying herself to sleep. She had a lot of concerns about separation anxiety. The family had gone through a lot the last couple of years. And we talked the mom through the situation, provided just a lot of emotional support, a lot of validation, a lot of listening. And we called the mom back and she was able to get connected with a counselor in her neighborhood for her child. And then the last one is kind of an out-of-the-box one. Like I said, we get calls of all kinds. We had a woman call us who was needing assistance with her broken heater. She didn't have heat for the winter. And so we were able to connect her with a weatherization program. And our phone counselor probably spoke with this woman 5 or 6 times, just following up with her, making sure she had what she needed. Next slide. All right, so this is just a screenshot of 1-800-CHILDREN-KS.org. And, everyone's prompted to enter a zip code when they first go to the website. That will help sort search results that are closest to their local area. On the bottom left is the select language button. That's where you can select whatever language you want to search in, and the whole website will translate into that language. And then the buttons at the bottom of the screen, if people have this enabled on their phone or computer or tablet, the buttons will call us, they will open an email that people can type to us, or open a text message to send to us. So again, they can contact us directly. And if you want a more thorough demo of how our website works, I'd be happy to provide that. My contact info will be at the end of the presentation. Next slide. This is just a screenshot of our mobile app that works very similarly to the resource database online. Again, it is free for downloading on Apple and Android app stores, and we are working hard to get this downloaded on as many phones as possible, professionals, families, so that way resources are available, you know, at the tip of your fingers whenever you need them. Next slide. So a bright spot with the resource database is we were able to text a woman with information about different resources who was homeless. You know, no longer do we have the challenges of needing a pen and paper when people reach out to us. We can send them information directly to their phone, to their email, so that way they have it, including when the program is open, a map of where they're located, all of that great information. Next slide. One thing that we ask all of our community partners assistance with is helping us keep a good, robust menu of up-to-date resources in our database. So if you know of resources that are not currently on 1-800-Children or resources that need to be updated, we have a guide for providers on how to add or how to claim their program to make updates. And I'd be happy to send this to anybody who would like to look more into that. Next slide. Okay, so here's numbers for the resource database for 2023. We had 59,380 database searches. We had over 100,000 distinct visitors. So not everyone who visits the website is doing like a formal search. And then we had 1,851 new mobile app downloads on phones or tablets. So I think the important information here is, what are people searching for? Well, it's a lot of the same things people are calling us about. So needed help with housing resources, food assistance, paying utilities, parenting classes, mental health, finding childcare resources, and then parenting concerns like at-risk behaviors, concerns with their children's behavior, things like that. Next slide. We have several resources available to all of you to help promote 1-800-Children. So we can have a live link or a search bar that can be included on other websites. That way people on your websites can connect with us directly. I have the widget code, the tech code. I can send it to anyone who's interested. Next slide. We also have social media posts ready to go for Facebook, Instagram, X, all those places that we'd be happy to send for you to share. Next slide. And then we have physical materials. So I'm sure a lot of you have our pens, our magnets, our outreach cards. Most of these are available to order at no cost to share with your colleagues and with families. We can ship them statewide at no cost. We cannot ship hand sanitizers because there's alcohol in them, but we can deliver them to you if that's possible. Next slide. Here is a QR code to access our online order form for materials. You can see the full list of all the materials we have available. You can also access it through our website. Next slide. And then I just want to end with a plug for Child Abuse Prevention Month. So Kansas Children's Service League is the Kansas chapter for Prevent Child Abuse America. So we oversee all child abuse prevention initiatives, and my team specifically, in addition to 1-800-Children, we also do all of the Child Abuse Prevention Month stuff. So we are working hard on getting our toolkit ready. We're going to create a video with ideas and resources for celebrating CAP Month, and that should be available in the later part of February. So again, to order any materials, here is our QR code to our order form. Next slide. Here is my information. I can put it in the chat as well, and maybe Julia can send this out to everyone so you have all of these slides. And Julia, I'll let you take it away.
So much. I don't see any questions in the chat at this time. But if anybody has anything that they would like to ask Michelle, you can go ahead and do so. And if not, we can just move forward to the early childhood systems updates. But I just want to give a huge thank you to Loretta, Mariah, and Michelle for that very relevant and useful information, just showing us some of the very easy to use programs that can get you help and referrals in the state of Kansas for yourself, someone you know, or the families that you work with. So thank you so much for all of that information. All right, thank you, Erica. I was going to say you can jump to the next slide. So just some general updates for you before we wrap up today. We have a funding opportunity in Johnson County. The Johnson County Department of Health and Environment and Raising JoCo, a childcare coalition, have announced funding opportunities for individuals wanting to start a new home childcare business, open a new childcare center, or are an existing provider and want to increase their capacity in Johnson County. Thanks to a grant from Childcare Aware and funding allocation from the Johnson County Board of County Commissioners, we are supporting the childcare expansion effort in Johnson County by having these funds available for a limited time, as I said, for new and existing Johnson County childcare providers. The funding is available on a first come, first served basis until the allocated amount is spent. If you have any questions or would like to apply for that funding, you can take down the emails on your screen of Eldona Chestnut or Nancy Johnson. And as you are writing down those emails, I will go over the individual benefits for each different type of provider through this funding. So for new childcare home providers, state and local initial licensure fees and fingerprint fees would be covered with grant funds. And for the first 25 Johnson County new home provider applicants, fees for the informational meeting and CPR and first aid training up to $80 per provider would be covered with grant funds. For new childcare centers, the first 10 Johnson County new child care center applicants are eligible for financial assistance to cover CPR and first aid costs and one additional class per person with coverage for up to 15 staff members per center. And for our existing child care providers, existing home providers that have opted not to run at full capacity, but are now willing to increase the number of children cared for up to their licensing maximum capacity, qualify for grant paid classes. This also applies for licensed day homes, switching to the group daycare home category. And for existing childcare centers that submit an amendment to increase capacity and or reopen a room previously closed, grant funding is available to cover the cost of training for staff to work in the new or reopened rooms. So those are the ways that this funding is being allocated to some of our childcare workers in Johnson County. So again, if you are interested in applying for that funding, you can reach out to Eldona Chestnut or Nancy Johnson. Go ahead to the next slide, Erica. This slide was on our presentation last month, but I felt that it was important to hear as many Kansas voices as possible for these changes that have been proposed through Head Start. So on November 20th, the Office of Head Start issued a notice of proposed rulemaking supporting the Head Start workforce and consistent quality programming with major proposed updates to the Head Start program performance standards. This proposal represents one of the most consequential changes to Head Start since the 2015 reauthorization. So for an overview of the process and a summary of those proposed changes, you can visit Head Start because they have a public comment period that closes in 9 days on January 19th. So if you would like to check that out, I am actually going to place all relevant links in the chat right now since I've got Erica working my slides for me. So all of those Head Start links you're seeing on your screen, you can find in the chat. And Erica, you can move on to the next slide, which is our early childhood conferences. So every month we're just going to probably feature 2 or 3 of the upcoming early childhood conferences. Last month, we highlighted the First 1,000 Days of Kansas Summit and the Kansas Division for Early Childhood Annual Conference. This month, we are highlighting Camp GWC Early Childhood Annual Conference being held on April 12th and 13th. The 12th is going to be a virtual day, and the 13th will be in person in Wichita. It's going to feature a variety of workshops, keynote speakers, and networking opportunities designed to enhance the knowledge and skills of those working with children. This is an annual early childhood conference that brings together educators, professionals, and parents to explore the latest developments in the field of early childhood education with its dynamic programs, engaging atmosphere, and opportunities for raffles and door prizes. Camp GWC is a must-attend event for anyone working in the early childhood education field. Again, the link is already in the chat for more information on Camp GWC. And then we also have the Kansas Association for Infant and Early Childhood Mental Health Conference, otherwise known as CAME. That will be held April 18th and 19th in Overland Park. You will be able to get 9.5 hours of KDHE in-service hours at this conference. Some of our topics include diversity-informed practices, self-care, birth equity and infant mental health, and much more. Thursday's conference keynote is Relationships, Regulation, and Resilience by Dr. Barbara Stroud. And Friday's conference keynote is Perinatal Peer Support, an Essential Component of Care by Dr. Melissa Hoffman. You can learn more by following that link in the chat for the CAME conference and register. The registration does close on April 9th. And for the best conference price, you can become a member of CAME because the conference and membership fees are actually less than the conference fee for a non-member. So if you've been looking for a reason to join our Kansas Association for Infant and Early Childhood Mental Health, now would be a good time if you plan on attending that conference at the end of April. Next slide. All right, ways to stay connected with us, reminders and next steps. Our early childhood recommendations panel meeting. Next meeting is on Friday, January 19th from 9 to 11:30 a.m. This meeting is always live streamed on the Children's Cabinet YouTube channel. Our next early childhood systems building webinar on the second Wednesday of February, which will be the 14th from 12 to 1. And we will have some representatives from our early childhood data integration system, and they will be giving us a demo and some information on our new distinct count dashboard. We will also have an appearance by Lindsay O'Ryan, who will be giving us some information on this year's 2024 Governance Summit that will be happening 2 days after that February webinar. Other than that, we have our Children's Cabinet meeting being held on Friday, February 2nd from 9 to noon. And as always, you can find all of these meetings, either their recordings or live streams, up on the Children's Cabinet YouTube channel. Next slide. Stay up to date with us as well by signing up for the weekly All In for Kansas Kids newsletter, following us on Twitter, or otherwise known as X, and subscribe to our Kansas Children's YouTube channel. Thank you so much for joining us this Wednesday. We will wrap it up. I know we're a few minutes over. We appreciate your time and your attendance, and we will see you next month. Thank you so much.